Hi, I'm Tori and I'm one of the physical therapists here at Dedicated Therapy. One of the diagnoses I see and treat a lot is vertigo or vestibular symptoms that can appear very different in different people. And I wanted to talk today about why it's important to get those symptoms checked, why it's important to see a vestibular therapist, not just any physical therapist, and how life-changing it can be when you finally get that correct diagnosis and treatment. So vestibular symptoms can be different for different people, and that's why I love working with it because it can be a bit of a puzzle for me. I like looking at the whole person, going through all the symptoms, and figuring out what this looks like and why for you, because it's very different for every person. Oftentimes, it is a simple diagnosis of something we call BPPV, and that is what most people think of as vertigo. And if that is a diagnosis, then there's a good chance that you could walk out that day feeling much better. If not, after 1 to 3 sessions with me, those symptoms could be completely gone. And that is very rewarding to me. And I want to share a story of how rewarding it really can be. So I used to work at a short-term rehab, and I met a patient there once who came in after a traumatic fall. He had broken several bones in his legs, so he was there for orthopedic reasons, trying to learn how to walk and walk safely as his injuries healed. And therapy was tough because he was still having this on and off vertigo or vestibular symptoms. Never really understood when they were going to come on. No one really understood why. And as I talked to him more, it became clear that these symptoms were the reason for his falls. It had gotten to the point that his daughter had moved in with him because he was having so many falls. And he was a fairly young guy. And he just didn't, the doctors didn't know why. He had been seen by a physical therapist, and there was no, rhyme or reason for these sudden onsets of dizziness, of falls. And this ultimately ended him, in the hospital, in a rehab setting with broken bones. And at first, it seemed pretty puzzling. He wasn't a clear, just talking to him. It wasn't oh yeah, this is BPPV. But we kind of dug into it. We did some testing, and that's what it was. It was that BPPV vertigo, and it would come on when he would tip forward. It would come on when he would roll in bed, turn his head too fast. So he had a pretty severe case, and from what I remember, I think there were multiple canals involved as well. But once I was able to treat him with positioning, which I can share with you in a later video, it went away. And at first, I think we were both a little like, is this going to stick? You had this for a really long time, and days passed, and he didn't have any more issues. So we were able to actually get, the therapy he was there for, working on his strength and his balance and walking better, because he wasn't feeling dizzy and sick every day. And I just remember him kind of getting teary-eyed with me, saying like he had been dealing with this for so long, and in an hour session, we got rid of it. So for me, that's very rewarding. And I know for the patient, it changed his life. And I just wish that we could have addressed that before he ended up having that traumatic fall and in the hospital with broken bones and in rehab. So a good but simple evaluation from a vestibular therapist can really make a big difference. And the reason it's so important to go to a therapist is the same complaints from one person can be for different reasons. So the therapist's job is to rule out, is it blood pressure related? Is it an inner ear issue? And with the inner ear, is it because one side isn't working as well as the other? Or is it, do you have those crystals dislodged, is how we explain vertigo. And then which canal? Like, there are a lot of little pieces, But when you are trained well and you know what you're looking for as a therapist, we can figure that out and get you the appropriate treatment plan. And there's no more guessing, hoping. There's no more, this is just how it is now. There really can be a good treatment and a fix for most of these vestibular issues. So before you dust it off and say, that's just how it is, this is what I'm dealing with, I've had it looked at and no one really knows why, make sure that you go to someone who specializes in vestibular therapy and get a thorough evaluation and, protect yourself from what can ultimately cause significant damage with falls or not even physical damage, but just the damage of not going out, not doing the activities, not being with the people you love because of these vestibular symptoms. So I hope that if you have these symptoms or your loved ones have symptoms, you will reach out. There's no harm in asking questions, getting a free screen here at Dedicated Therapy, and we can tell you if you're appropriate for therapy, and then getting a full evaluation. So again, my name is Tori. I'm one of the physical therapists here at Dedicated Therapy, and if you or your loved one are dealing with balance, dizziness, vestibular, or vertigo symptoms, or even if you think you might be, give us a call, and we will do everything we can to help.